I thought I'd talk about some trusted partners that I utilize as resources as a practitioner. Most people, when they come in these days, they're a little confused as to who to believe. I mean, there's Dr. Google, there's 4, 5, 6, 7, 8 different types of AIs. There's my friend on the street, there's my mom at the soccer club that told me XYZ, and then there's my provider who told me yada yada. Who and what do I believe, right? And I think we have so many educational platforms and resources at our fingertips these days that data overwhelm is a very real thing. And so I'd like to talk just a little bit about who I believe, how I filter through some of that noise of overcrowding when it comes to all the voices that can tell me all the things. And then the trusted partners that I've landed on as a practitioner and who I bring into the mixture of my practice to help treat people and get them well in their own health journeys. So, for example, okay, let's talk about maybe the scientific literature sources that I'll use. One of them is called Up to Date, another one is called Dynamed. It is basically like a walking, talking, huge Bible encyclopedia of anything from a stub toe to thyroiditis to non-Hodgkin's lymphoma. If I type in as a practitioner, renal failure, or I type in something like eustachian tube dysfunction, it will tell me based off of stratified literature evidence how to treat, what the pathophysiology is, different things to consider, contraindications to certain treatments, risk factors for this condition developing, and other things. And it's a very nice, comprehensive, very extensive Bible in that sense of me being able to make sure that I'm in check with my understanding of the condition, how to treat the condition, and then anything that might be influencing it positively or negatively, and kind of where to go from here. That's Up to Date, and that's Dynamed. I used those when I was in the hospital. I still use those today because I think it's a very good literature source of information. But then I also rely on things like you as the client and as the patient. You are my biggest source of information. Your story, your history, your experiences, your context, what has worked for you, what hasn't worked for you, when it all started, how you're dealing with it. That is one of my biggest gold mines as to how do I treat and how do I diagnose. If anything, actually, your practitioner should be primarily listening to you because we will get so much more out of perhaps a 5-minute conversation with you where you're defining the whole narrative and where you're giving us all of this information about you than we ever would by topping into Dr. Google. Well, if you said, hey, I have a stub toe, and then I interrupt you and said, hey, hold on, let me Google stub toe. Now I want you to tell me, how did you stub the toe? Where did you stub the toe? What part of your toe hurts? What does the toe look like? Is it running a fever? Things like that. So you as the patient, you as the client, you as the guest member, whatever term they use these days, you are my biggest wealth and my biggest source. So there's medical literature databases that I like to run by, EBSCOhost and Up to Date are two of my favorites. For supplements and things, I sometimes like to go to the Mayo Clinic or Memorial Kettering Sloan for some of their public literature and databases on herbs and things like that. But then you as the client are my second source, always. And actually, you should be my first. I should have put you first, I'm sorry. But you're my first source of information and valuable wealth. Second source will be medical literature. Third sources will be things like, for me, trusted researchers, clinicians, pharmacists, and colleagues who maybe have a Substack that I'll read. Or maybe I get to call on the phone just because we're friends and they have all this wealth of experiences that I can lean on and pull from. One of my favorite Substacks is called Courageous Discourse. It is by Dr. Peter McCullough and then Nicholas, I want to say Hozier, don't kill me on the mispronunciation of that. He's an epidemiologist. And they really go into the latest on the block when it comes to long haul illness from the pandemic. And they dumb down the literature for simple people like me and you to be able to read, but they give you the most up-to-date information on things that we should know about because we've had such a muddied waters of immune system dysfunction, of autoimmune diseases, of cancer states, and a whole host of other things that came from the pandemic outfall. And so I like Courageous Discourse as a Substack information because it will give you, it's the best $5 you ever spend. It will give you the research articles that are just hot off the press, and then it will give you the dumbed down interpretation of them so you can strategically make decisions for people's health, not only ours personally, but the people around me that I'm trying to treat. So I like to follow certain clinicians' Substacks. Dr. Peter McCullers is one of them. And then I really love my pharmacists, genuinely, my compounding pharmacies, calling them up, chatting with the pharmacists about, hey, something called Amlexinox came across my desk. I don't really know how to use it, but I'm hearing that it's doing some really cool work for A1Cs. And I will sit down with them and they will train me on a little bit of the molecular chemistry, on the repurposed use of them, side effects to watch for, and then what patient population data set might be the best strategy to employ these things too. So I use pharmacists a lot, and I think they're highly, highly creative and knowledgeable people, but they're a very relevant source to treating my patients and clients and guests and members of things. So medical literature, you yourself, the client, is the patient, Substacks from researchers and clinicians and colleagues, and then pharmacies are my top, let's say, 4 valued resources when it comes to making informed decisions for every client or case in front of me. And then I would just say my own experience and colleagues' other experiences. I forgot to say Worlding Medical, for example, in the bioidentical hormone therapy community that I have credentialing from, we actually have an online resource platform where they also have a medical Bible of literature, research published literature that I can search through to say, hey, fibroids, low progesterone, correlation of things. Or testosterone, how does that support, yay or nay, the stimulation of the bone marrow for red blood cell creation, etc. I can look up all those things instantaneously, but also we then have a member community in there, and so I can be talking with an epidemiologist or an endocrinologist in Kansas, and they can be giving me their feedback on some puzzling condition that might be in front of me. So a wealth of information from a bunch of different sources, but just know that when you're coming to see myself, you're really getting a team, and you're getting a team from multiple points of view and different perspectives that then will hopefully influence your outcomes in a favorable light. So thought I should just tell you a little bit more of the behind the scenes, but these are my trusted partners when it comes to making informed choices with you as a full team.